Today we will discuss about the posterior triangle. The neck is quadrangular in nature. This is the anterior midline. This is the upper part of the neck, which is from the base of the mandible to the mastoid process, and posteriorly there is a superior knuckle line. Below it is a clavicle, and the posteriorly there is a posterior midlines, and the neck, which is divided into the two part by the sternocleidomastoid muscles, and it divide the anterior to it, anterior triangle. This is the anterior triangle we will discuss later on, and this is the posterior triangle. So we will discuss today the posterior triangle. First of all, I have removed the skin and superficial fascia as well as the investing layer of deep cervical fascia. Here you can see this along with the investing layer of deep cervical fascia. This is the platysma muscles, and this is the also a investing layer of some portion of investing layer of deep cervical fascia. So we will discuss about the boundaries of the posterior triangle. The posterior triangle, anteriorly it is bounded by the posterior border of sternocleidomastoid. This is the sternocleidomastoid. Posteriorly it is bounded by the anterior border of the trapezius, and below it is medial two-third of the, or base it is formed by the medial two-third of the clavicles, as well as the apex, which is the meeting point of the sternocleidomastoid and trapezius on the upper aspect. Roof, which is formed by the skin, we already removed. Superficial we already removed, and there is an investing layer of deep cervical fascia, and there is a platysma muscles. So investing layer of this cervical fascia, which is pierced by the four cutaneous nerve, you have to remember. This is the nerve which goes along with the posterior border of the sternocleidomastoid. It is a lesser occipital nerve. It is a fiber of the C2, ventral rami of the C2, and it supplies the skin over the mastoid process and back of the side of the lateral side of the scalp. This is a lesser occipital. Another nerve, it is a great auricular nerve. This great auricular nerve which crosses the sternocleidomastoid, and it goes towards the auricle over the apex. This is the parotid gland, and this is the apex of the parotid gland. This great auricular nerve, which is mainly supplies to the skin on the back side of the parotid, skin over the back side of the parotid region and mastoid process, and it is formed by the ventral rami of the C2 and C3 fibers. Another nerve, it is the transverse cutaneous nerve, transverse cervical nerve, and this transverse cervical nerve, which goes anteriorly, it crosses the sternocleidomastoid, and it divides into the ascending and descending branch. Mainly it's innervate to the cutaneous innervations to the skin over the carotid triangle. It is also formed by the ventral rami of the C2 and C3. It is the transverse cutaneous nerve. And fourth cutaneous nerve, it is a supraclavicular nerve. Here you can see this is the supraclavicular nerve, and this supraclavicular nerve, which is divided into the three part. Here you can see this is the most medial portion, medial, this is the intermediate, and this is the lateral. Medial medial cutaneous supraclavicular nerve, which supplies to the sternoclavicular joint, skin over the sternoclavicular joint, and it extends up to the second intercostal space. This is the intermediate, which sometimes pierces to the clavicle, and it supplies to the skin of the second intercostal. Supplies intermediate supplies to the skin up to the second intercostal space, and the lateral supraclavicular nerve, which goes laterally, and it supplies to the skin over the acromioclavicular joint and acromioclavicular joint it supplies. So this is the all these four cutaneous nerve: lesser occipital, great auricular, transverse cervical, and supraclavicular. Supraclavicular nerve, it carries the fiber of the C3 and C4. So all four cutaneous nerve, which lies inside the roof of the posterior triangle, along with the great auricular nerve. Here there is external jugular vein, but I have cut it for the deep dissection. So external jugular vein, some portion of the external jugular vein, here you can see this is the portion of the external jugular vein. So it open inside the subclavian vein. So these are the structure: 4 cutaneous nerve, lesser occipital, great auricular, transverse cervical and supraclavicular nerve, as well as the external jugular vein, which is lies inside the roof of the posterior triangle. Now we will discuss about the floor of the posterior triangle. Here you can see this is the first muscles. It is a semispinalis capitis. This is the semispinalis capitis. This is the another muscles, which is the splenius capitis. This is the levator scapulae muscles. So from posterior to anterior, 3 muscles: semispinalis capitis, splenius capitis and levator scapulae. And further anteriorly, another 3 muscles are called the scalene muscles. How to identify the scalene muscles? You have to, I will just put the supraclavicular nerve on the sides. You have to see the identify the brachial plexus, root of the brachial plexus, mainly the C5 and C6. Anterior to it, this muscle, it is called the scalenus anterior. Behind to it, scalenus medius, and just behind to it, scalenus posterior. Always you have to remember, above to the scalenus anterior there is a nerve. It is a phrenic nerve. Here you can see this is a phrenic nerve. So this is a phrenic nerve, and this brachial plexus, mainly the root, in front this is scalenus anterior, behind to it scalenus medius, and scalenus medius, which is pierced by the 2 nerves. Mainly here you can see this is the fiber of the root of the C6, and this is the fiber of the root of the C5 united. It makes the nerve to serratus anterior, and the fiber of the C7 joined from the below side. So the fiber of the C5 and C6 are pierced to the scalenus medius and united. After that, it is the fiber of the C7 root which is united, and it makes the nerve to serratus anterior. Another nerve here you can see, this is the which goes posteriorly. This is the dorsal scapular nerve, this coming from the C5 fiber, and this dorsal scapular nerve, it is also called the nerve to rhomboids, which supplies to the rhomboids major and minor, while the nerve to serratus anterior supplies to the serratus anterior. These 2 nerve pierce to the scalenus medius. You have to remember. Another vessels which is lies inside the triangle, inside the posterior triangle, it is the transverse cervical nerve vessels. This transverse cervical nerve, it is a branch of thyrocervical trunk. It is the first part of the subclavian artery. This transverse cervical divide into the superficial and deep branches, which goes transversely inside the posterior triangle. Further, we will discuss about the posterior triangle, which is divided into the 2 parts by the one muscle. This one is a muscle. It is called the inferior belly of homoid. This inferior belly of homoid divide the posterior triangle into the 2 parts. Upper part, it is called the occipital portion of the posterior triangle, and lower part, it is called the supraclavicular part of the triangle. This supraclavicular part of the triangle, which is contains the, you have to remember, root of the brachial plexus. Here you can see root and trunk of the brachial plexus, as well as you have to remember, here I just elevate this clavicle. Here it is just beneath to the clavicle, so difficult to show from these sides. So here you can see this is a subclavian vein, and subclavian artery also lies inside the supraclavicular triangle. Another thing you have to remember, scalenus anterior, phrenic nerve, portion of the phrenic nerve, transverse cervical vessels, as well as the external jugular vein open inside the subclavian vein, terminal portions, and subclavian vessels, and the root of the and trunk of the brachial plexus. Here you can see the root and trunk of the brachial plexus. This is the root and trunk of the brachial plexus on the upper side. Here easily you can see. So this is the content of the supraclavicular portion. The other content inside the occipital portion of the posterior triangle, it contains the main nerve. Here you always remember this tortuous nerve. Just it is winded by the spinal accessory, winded by the lesser occipital nerve. So this is the spinal accessory nerve. This spinal accessory now goes to the deep to the trapezius, and it supplies to the trapezius muscles. Here you can see I will just reflect to the sternocleidomastoid. I will show you the this spinal accessory coming from the beneath to the posterior belly of digastric, and it gives the branches to the also to the sternocleidomastoid muscles. So here you can see this branches given to the sternocleidomastoid muscles also, and then it gives the branches to the trapezius muscles. Another content inside the posterior triangle, it is the, here you can see these are the branches of the C3 and C4 which supplies to the levator scapulae, as well as it is a proprioceptive fibers given to the trapezius muscles. Now to rhomboids which is present inside the occipital. Here you can see fiber of the C5 and C6 united, it makes the serratus anterior, and C7 from the below sides it is united, as well as transverse cervical vessels which is lies inside the occipital triangle, and the floor muscles which is lies inside the occipital triangle, plus root of the brachial plexus into the upper portion of the occipital triangle. Here you can see root of the brachial plexus which is lies inside the occipital triangle. So this is about to the content of the posterior triangle. We already discussed the boundaries, floor, content, roof of the posterior triangle. So hope you enjoy the lecture. Thank you very much.